Good day everyone, I am Laura Jane Oteros, a student nurse from Pamantasan ng Lungsod ng Marikina, and I am here to perform oral drug administration. So, oral drug administration is the most common route in taking drug medications. So, why? Because it inhibits advantages like patient good compliance, safety, and pain avoidance, and many more. So, before we start, we need to determine or we need to observe for the 5 R's or the 5 rights in drug administration, which is the right patient, right drugs, right dose, right route, and right time. It is important to know all those five rights of drug administration because for us not to have a medication errors or harm. Before we start the preparation, of course, we need to assemble all the equipments and do the hand washing procedure or the universal precaution to avoid cross-contamination of the drugs. And then next is, before putting it into the medication cup, we need to determine if it is expired or not. Then next is get the drugs and compare it to the MAR or the doctor's orders. And if you are confused, you can always ask the doctor for questions about what you're confused of. Check and then put it in the medication cup. And then for the next one, if it is for the same person, check for the MAR and put it again in the same medication cup. And we need to prepare for one patient at a time to avoid confusion. Next is, if this tablet is too big for the patient, he or she cannot swallow it like this big, we can crush it and then mix it with a syrup, can be apple cider or honey. And of course, if we just need a 250 milligrams, this is 500 milligrams, we can crush it into half and you can throw the other half away or put it in the same lid for other purposes or for preserving it for the next. Then compare it to the MAR and then put it in the medication cup. Label it to avoid confusion. Next is the rationale for not taking it in the packaging for us not to be confused of what drug is this. Next is syrup. Of course, you need to check if it is expired or not. And then compare it to the MAR or the doctor's orders. Shake well. We need to always check if it is cloudy or not. If it is not the same color as it is, even if it is not expired, then get the cup. Pour the syrup into eye level for us to get the right amount of syrup that we needed. Assuming we only need 7.5 ml. And then make sure to wipe the opening of the cup not to spill it. So we have the right amount. Using a syringe as a oral drug medication, there is a specific syringe to be used in a syrup, in a medicine syrup, but we have no material like that, so we will be using a 3 ml syrup or 3 cc syrup. Make sure that your hands are washed to avoid contamination, and then get the syrup that we will be needing, of course. I now have a 3 ml syrup in this syringe, and we have to label it for us not to get confused. Now we are prepared to give this to the patient that we will be handling. And now, before we go to the patient, of course, check again the MAR if the drugs that you prepared are right. Always remember the 5 rights of drug administration. After we go to the patient, we need to identify and verify the client's identity, explain to the client what we are going to do, why is it necessary, and how the client can cooperate. You can ask the patient if the patient has allergies in this kind of medicines that we will giving him or her. And then tell the client for the possible side effects of this kind of medications. And then provide privacy by drawing the curtains or closing the door. And make sure to position the patient into semi-Fowler's position if you are giving him or her the medications, because after the patient take this, he or she needs to drink water. And then we are positioning the patient into semi-Fowler position to avoid aspiration. After the patient have taken the medications that we gave them, make sure that the medications are completely swallowed, and then document all the findings, and then sign. Of course, we have to sign. That is the most important thing, because if we didn't sign the patient's records, the next nurse that will handling them will get confused if they already got the medicines or they already took the medicines. So that's it for the oral drug administration preparation. Thank you.